Doug Beirness is with the Canadian Centre on Substance Abuse, and he joins me now from Ottawa. So, Doug, first of all, should people be worried about people driving high on cannabis?
Well, I think there's good reason for people to be certainly concerned about it. There's no doubt about that.
Tell me why.
Well, we already have cannabis that's being used by drivers, and we know that there's a tremendous number of crashes that occur as a result of cannabis use by these drivers. And fatalities certainly are one of the most serious consequences of that. We also know that in jurisdictions like Colorado and Washington, they have seen increased traffic fatalities and increased use of cannabis by drivers following their legalization of cannabis.
So what happens to someone who is on marijuana, and how does that influence their ability or their lack of ability to drive properly?
Well, the first thing to remember is that the effects of cannabis can be very different than the effects of alcohol. So we're not looking at necessarily the same thing at all. And the primary effects of cannabis tend to be cognitive in nature. That is, they're internal. They deal with concentration and being able to attend to different things in the environment. So what we're getting is people who are not necessarily paying attention to the correct things when they're driving. There's also the physical part, which is more or less similar to alcohol, in that there is some motor incoordination and fine motor coordination and things like that. So there's a number of things that really interfere with a person's ability to operate a vehicle safely.
Is there an objective standard to know when someone is too impaired to drive?
That's a really difficult question. For example, when we set the limits for alcohol, we have an 80 milligram per deciliter limit for alcohol. We relied on the scientific evidence to set that limit, and it separates those people who are mostly, the majority of people who are impaired against those who are not impaired. We're having difficulty finding that exact point for cannabis, and a lot of that has to do with the differences between cannabis and alcohol and the pharmacokinetics associated with those two different drugs. And where it is right now is we really can't find that one point that distinguishes between cannabis impaired drivers and cannabis drivers who are not impaired.
Well, that sounds very problematic in terms of being able to detect, enforce, and keep the roads safe.
Well, actually, such limits, so-called per se laws, are really intended as a legal shortcut. They can be a shortcut for the police as well, but it's primarily a shortcut. What we're really after is keeping people who are affected adversely by the use of cannabis off the roads. And to the extent that per se laws encourage and allow that to happen, then they're a good thing.
I don't know exactly what that means, though. Can you explain that a little bit?
Well, we want to make it easy for the police and prosecutors to be able to get those people off the road who shouldn't be there. That is, they have smoked cannabis or used cannabis in some other form and are adversely affected by it, versus identifying those people who are not so affected by the cannabis. And the way we do it right now is having the officer identify a driver who has possibly been using cannabis or some other drug, actually, and proceeding with a series of tests, either at the side of the road and then on to the station where a drug recognition expert will evaluate the person and determining their level of impairment that way. A per se law could short circuit that and take the person right from the side of the road to getting a blood test possibly.
So is this effective? Is this an effective way of keeping the roads safe and keeping people who shouldn't drive while high on pot off the roads?
Well, I think it's one more tool in a police officer's arsenal to be able to do what they think they need to do in order to keep the roads safe for all of us. There's certainly no perfect solution here, but we need to be able to give officers all the tools possible to allow them to do their job effectively.
But alcohol is easier to detect, right, than cannabis?
Most definitely alcohol is easier to detect than cannabis. And that has a lot to do with the nature of the substance we're looking for. Alcohol is very water soluble, and the relationship between the amount you drink and blood alcohol concentration and impairment is pretty straightforward. That's not the case with cannabis. It's just not that simple.
All right, Doug, thank you. That's Doug Beirness, is with the Canadian Centre on Substance Abuse. in Ottawa.